but let me just go into further detail about that. So the berberine HCl is the one form that has been the most studied, and the berberine is bound to HCl, and so that gives it more stability and better absorption. It's been the most studied as far as the clinical research that's out there, and it's effective for gut health, blood sugar control, cholesterol control, and indirectly may help with weight loss. And as I mentioned, I typically will start with 500 milligrams and then work the way up to about 1,000 milligrams twice a day. Sometimes you may need higher doses than that, and sometimes you may need it dosed 3 times a day, but work with your healthcare provider on that. And then the berberine phytosome form is berberine that's bound to fatty acid, and it may actually absorb 5 times better than some of the other forms of berberine. So you may actually just need a lower dose. You may not have to take as much as you do with the hydrochloride form. It also tends to have less risk of gut symptoms. So sometimes if you've tried the berberine hydrochloride form and it bothered your gut and you couldn't take it, you might want to give the phytosome version a try because it might be better tolerated because it's in that fatty acid. So a typical dose is about 550 milligrams. You could start with once a day and then increase it to twice a day. And then there are some other forms too that may be effective. There's berberine that's with silymarin, which is also called milk thistle. So this may be good if you also need some liver detoxing components. Milk thistle may help with that. So there are berberine complex or blends. These are ones you have to be careful with because they have other supplements in them to combine with the berberine. So whatever it's combined with, you just want to make sure that that other substance is something that you actually may need and that won't harm you. So you want to work with your healthcare provider on that. So I'm just curious, have you ever tried berberine? And if you did, which form did you try?